Welcome back. It's the week of April 21st, 2020, and I'm happy to announce that we currently are offering the Virtual Pain Fellowship on the PainExam website, or you go to www.virtualpainfellowship.com, and you just enter in your name, email address, and program director's email address. He'll receive an email that he can respond to verifying that you're actually a fellow, and you'll get a temporary access until July for the lectures and videos I've posted. In addition, there are other free resources donated by some generous people such as Dr. Trescott and a few others, which I'll post soon. In addition, NYSIPP is having another webinar moderated by Sudhir Diwan. It's on April 29th, and it's entitled Getting Back to Work After the COVID-19 Crisis. And as we think we've peaked in New York State, we are starting to think about how we're going to get out of this and how we're going to slowly ramp up. And people are already talking about working 6-7 days a week. However, I don't anticipate that the ramp up will be so dramatic. I do think it'll be more gradual. That's just my personal prediction. In addition, other announcements. As you can see here, I'm working on the PainExam news page. So we're going to have a page on the PainExam website, which is, we already do have one, but this is going to be a little more developed, which features updates as to what's going on in the pain world. We also have a lot of good stuff coming out with the Virtual Pain Fellowship. I intend to add to it and hopefully provide you with more value and content over time. In addition, April 26th, this coming weekend, was supposed to be the day of my ultrasound course, which of course is not going to happen in the way I anticipated due to the fact that New York State is under lockdown for the coronavirus. So that course will be postponed in terms of the practical format. However, the didactic format is going to happen. And I will be offering access online if you choose to access it. It's 7 CME credits. The first 3.5 CME credits will be available to those who tune in. So basically, I'm going to have the didactic portion done this week via online Zoom webinar format, and the in-person practical training with a model and actually getting your hands wet will be done hopefully in May or June when the restrictions ease up. So check out the PainExam Events page and you'll get the details on if you can sign up for at least the Zoom part of the lecture, which is about 3.5 hours long, and it's for advanced pain procedures. Topics that the advanced ultrasound course will feature are the spine, the peripheral nerve blocks, of course, some soft tissue injections. I added a bit on the cluneal nerves, which is still new to me, and I'm trying to get my act together with that, but I think it's something that is not touched upon in a lot of pain practices, and I found quite useful in my practice. I've done them with ultrasound and x-ray. The ganglion impar block, which I just started doing under ultrasound, as well as many more. I also take requests, so if there's something that you want to learn in particular, please send me an email. I'll do my best to make it happen. So now I'd like to present to you a letter sent on April 20th, 2020, yesterday, on behalf of American Society of Regional Anesthesiologists, ASRA, by their president, Dr. Vescusi, to Mr. Verma of CMS. And this is regarding Medicare and Medicaid programs, policy and regulatory revisions in response to the COVID-19 public health emergency. They address it to the Administrator Verma, and they mention that ASRA, functioning as a voluntary organization representing chronic and acute pain medicine physicians nationally and internationally, dedicated to the use of evidence-based non-opioid pain management, treating acute and chronic pain, and only using opiates when necessary, and that ASRA represents small group practices as well as large practitioners in private and academic healthcare systems. Thank CMS and applaud them for taking swift action to ensure the members have the necessary flexibility to continue caring for the patients during this crisis. They mentioned the following recommendations that were made: to waive the video requirement for furnishing E&M services via telehealth and for all sites of service. If waiving the video requirement is impossible, they are recommending that there's an increased reimbursement for the telephone E&M codes to a level that is at least commensurate with the office outpatient EMM services. They're also asking to monitor implementation of these and other virtual care services and policies by Medicare administrative contractors. Through waivers, enforcement discretion, and rulemaking, CMS and its federal agency partners have helped millions of seniors access the care they need from wherever they are located. To further access care, and where beneficiaries do not have access to or struggle with the video component, CMS has activated the telephone E&M service code 98966 to 98968 and 99441 to 99443. Payment has been effective March 1st, 2020 for the duration of the COVID public health emergency. The telephone E&M codes allow clinicians to provide evaluation and management services to beneficiaries using audio only. In addition, although the code descriptors only reference established patients, CMS is using its enforcement discretion so they can be used for new and established patients during the public health crisis. Despite these welcome changes, ASRA members are concerned that Medicare's current reimbursement for these services do not adequately reflect the work involved in delivering a robust E&M service in audio-only format. To demonstrate the difference, they've included a table below that shows the Medicare reimbursement for the office outpatient E&M services delivered in the office setting versus the telephone E&M service codes. To that end, ASRA urges CMS to use its authority to waive the video component and requirement for furnishing E&M services via telehealth. This is across all settings and places of service, including office outpatient settings, as well as inpatient and hospital settings. If CMS is unable to use its authority to waive the requirement, they urge the agency to increase reimbursement for the telephone E&M services so it is at least comparable to the reimbursement for the office outpatient E&M services. Since there's a lot of complexity associated with the number of changes, they also urge CMS to monitor implementation of these and other virtual care and telehealth services by its Medicare administrative contractors. And I posted the table that's listed in their letter that I think you should all look at. And if you're not watching this, if you're on the podcast and just listening to it, you'll see if you log into the PainExam news page where I'm posting this video, the differences in the payment based on the 99441 to 443 codes. 5 to 10 minutes is only $14 for the lowest code. It's really not much. So it's something that I think you should all check out. And I'm a member of ASRA. I really don't do much yet. Hopefully I will soon in terms of the marketing component I do with NYSIPP, ASIP, as well as the other organizations such as NANS, and the EPA. But I think ASRA really has been a great society that I support and always will support, and I hope that they continue to do the good work. I want to thank you, Dr. Vescusi. I think you really nailed it. So I think it's really important to bring you that letter because I think it's good for you all to know that there are things going on in the background. People who are advocating for us, societies that we pay dues to that are actually putting work into representing us and taking care of our needs. There are a lot of societies. You can't join them all, unfortunately. So, and I think wherever society you join, it's important to support them, what they're doing, their educational endeavors, as well as contribute if you can in any way. I'm not very active on any boards for any societies. My contribution is through my PainExam platform, in which I give them free marketing and leverage my platform so that their voices can be heard across the country and web. And they've been very kind to me in other ways by helping me promote fellowship education, the PainExam board review, and much more. So that being said, I think with this slow ramp up, things will hopefully start to improve, but the question lies what will be after that. I think telehealth will be a bigger part of almost all of our practices. The question is, how will it be done? Will we go back to the old regulations? And how long will this crisis be with us? I think it's going to be a very gradual ramp up. My prediction is we will get busier. We will see people more in the offices in person. However, I think there's going to be a big fear factor for the elderly and the patients who have higher risk factors, and the patients who have more risk factors. Thank you for listening. Thank you for tuning in. I wish you all the best. Take care. Good luck.